morning, everyone. So today I'm going to finish it off vitamins. I know everyone has been waiting to hear me finish up. Thank you so much, everyone, for your prayers. I'm learning to listen to my body. When my body says stop, slow down, then I have to stop and slow down. So even the nurse sometimes doesn't feel too well and have to take care of herself. So thank you so much, everyone, for your prayers and for checking in on me on last week. Thank you so much again. So vitamins that you cannot take together and the ones you can. This is where we're going to be picking up from today. So supplements, if you do not know, can interact with medication. There are certain dietary supplements that can change the absorption, how you metabolize, and how you excrete those medication. So there's several common vitamins and supplements and which medications they may interact with that I'm going to go over with you today. Ashwagandha is one of them, which is a herb that is used traditionally by Chinese medicine. It's a small evergreen shrub found in dry areas of India. It's touted to help the body fight stress and insomnia. So a lot of people is known for actually taking this. So this is just one of them that I'm going to be going with, and also some others. It also can risk you lowering your blood pressure if you're taking it with your diabetic meds and certain other medications. So I want to go through some more now. So let's talk about iron and green tea. Now, I'm a person that loves to drink green tea. Why? Green tea gives me energy. So instead of drinking coffee, I tend to go to green tea. But taking green tea with iron can reduce the absorption of the iron mineral. So while the effect might not be significant for most people, if you take both, you can still consider taking them at separate times. It's important you try to take it separate times, okay? So iron and calcium. So if you're taking calcium and iron supplements together, this will block some of the iron from being fully digested. Plus, it may lead to an upset stomach. So while you don't need to go crazy planning your meals perfectly to avoid this combination, it can be helpful to avoid an iron supplement with a high calcium meal, especially for those of you that suffer from anemia. So you want to avoid such like milk, leafy greens. Instead, take iron on an empty stomach if possible. Some people cannot take it on an empty stomach, or at least separate these supplements by taking one in the morning and the other later in the day. Vitamin D. Now, vitamin D is something that many of us, especially African Americans, we think that because of the color of skin, we don't lack vitamin D. But a lot of us do have low vitamin D. That was one of my issues last week. I had missed my vitamin D a couple of days, and my vitamin D level got so low that I could hardly get up. I was so fatigued from that. So taking vitamin D and items that have aluminum, which may be used to treat high serum phosphate levels in people with chronic kidney disease, might cause harmful levels of aluminum in people with kidney failure in long term. Interactions with like anticonvulsants, like people that take Dilantin, it increases breakdown of vitamin D and reduce calcium absorption. Lipitor, taking vitamin D might affect the way your body processes this cholesterol drug. Another one is cholestyramine. Taking vitamin D with this cholesterol-lowering drug can also reduce the absorption of vitamin D. And then there's digoxin. A lot of people take this as well. Avoid taking high doses of vitamin D with this heart medication. High doses of vitamin D can cause hypercalcemia, which increases your risk of fatal heart problems when you're on the digoxin and taking vitamin D. Thiazide diuretics. So taking these blood pressure drugs with vitamin D increases your risk of hypercalcemia. Steroids, if you take steroids, taking steroid medications such as prednisone can reduce calcium absorption, impair your body's processing of vitamin D as well. Stimulants, long-term use of high doses of stimulants can reduce your vitamin D and calcium absorption. So just be mindful of just some of these that I'm going to go through. I'm not going to go through everything line by line. Ashwagandha, I just spoke about. Drugs for high blood pressure. There's research that suggests that ashwagandha may lower your systolic and your diastolic blood pressure, putting people who take blood pressure lowering medication at risk for hypotension and blood pressure that is too low. So you don't want to take it together. Be mindful. And I want to make a disclaimer. You want to make sure that your doctors are aware if you're taking vitamins as well. Immunosuppressants. Research has shown that ashwagandha can stimulate the immune system. In addition, animal research has shown that ashwagandha can decrease the effectiveness of the immunosuppression caused by cyclophosphamide, a drug used to treat cancer and nephrotic syndrome. Zinc. Antibiotics. Certain antibiotics, especially one that is commonly used around is Cipro, interact with zinc in the gastrointestinal tract and don't allow the absorption of both the zinc and the antibiotic. So if you need to take both, take the antibiotic at least 2 hours before or 4 to 6 hours after taking a zinc supplement. Zinc decreases the absorption of penicillamine, which is used to treat rheumatoid arthritis. If you need to take both, zinc supplements should be taken again at least 2 hours before or after taking this medication. Melatonin. Some of you may not have heard of it, some of you may have. Melatonin is a hormone your brain produces when it's dark. It helps with the timing of your internal clock and with sleep. So some people take this, it's over-counter, take this instead of taking a prescription sleep medication. Melatonin may interact with several medications. That includes blood thinners. So there are some case reports of minor bleeding and decreased production of protein, which is a prothrombin, in people that take melatonin when they're taking blood thinners like warfarin. Melatonin interaction also with anticonvulsants, just to name a few. Okay. Some research also suggests that oral contraceptives can increase the levels of melatonin, thereby increasing the effects and possible adverse effects of melatonin supplements. Potential adverse effects of melatonin includes headache, dizziness, nausea, and you can get really, really sleepy taking this medication as well, although it's over the counter. So let's start about spacing your vitamins. So vitamin C and vitamin B12. To help your body use these essential nutrients, space out vitamin C supplements from B12 supplements by at least 2 hours. Vitamin C can interfere with your ability to absorb B12, so it's best to take these separately. So some people might say, well, I have a multivitamin that have C and B12. Well, they put the right amount in that multivitamin, but if you're someone that you have a low vitamin C level or low B12 level and need to take extra B12, this is actually for you. What supplements should not be taken with vitamin E, D, E, and K? Vitamin D and K. Iron and copper also seem to interact with a vitamin called selenium, which I spoke about a couple weeks ago, and inhibit the uptake of that element. Iron and calcium. Taking calcium and iron supplements, again, make sure you're spacing that. Magnesium and calcium. Now, although these two minerals work together and aid in its absorption, there must be a balance for it to be effective. Too much calcium can actually have the opposite effect, preventing magnesium from being absorbed. So make sure that you're taking the right amount of dosage. Copper and zinc. Zinc can interfere with copper absorption, especially if you take high doses every day. Generally speaking, taking large amounts of minerals with other minerals will reduce absorption of both. So try to take them at least 2 hours apart if possible. Vitamin D and vitamin K2. Some people told me they've never heard about this K2. They actually complement each other. Vitamin K2 helps calcium move from the blood to the bones. However, if you take large doses of vitamin D without sufficient K2, the calcium can go the wrong place. So be mindful of that. Proton pump inhibitors, which are medications that lower stomach acid, can decrease the absorption of your B12, whereas metformin, a popular diabetic drug, can decrease levels of both B12 and folate. Birth control pills can also deplete several B vitamins, including your B6, B12, folate, and riboflavin. So some strategies to help your body absorb nutrients most effectively. Avoid taking fat-soluble vitamins on an empty stomach. These include your A, D, E, and K, which are absorbed best with some fat, such as olive oil, nuts, seeds, fatty fish, eggs, and avocado. While you may be taking these vitamins together in a multivitamin, if you're taking individual fat-soluble vitamins, as I discussed, it's recommended that you space them out. Most often, multivitamins should be taken with a meal in order to prevent nausea, because some people say it's very strong because you have all the different minerals that is in it, okay? B vitamins can be taken together and may be combined into a B complex. Don't take your B vitamins at night, you'll be up all night. While there's some vitamins you should avoid taking together, there are others you'll want to combine in order to support the absorption. So like your iron and your vitamin C, your vitamin D and your calcium, those help with the absorption. If you take an antioxidant supplements, Take it separately from a multivitamin for the most beneficial effects. Be especially careful about avoid taking calcium supplements and antioxidant supplements together, since calcium can decrease how the body uses the carotenoids like beta carotene, lycopene, and ataxanthin. Keep in mind that supplements containing vitamins, minerals, and omega-3 fatty acids can also interfere with many common medications, such as your blood thinners and your thyroid medications. Therefore, I implore you to talk to your doctor about your supplement routine if you take daily medications. And most doctors, they don't have a problem with you taking your vitamins, just have to be honest with them about what you're actually taking. So some of the best combinations, your omega-3 and vitamin E, taking these supplements together can enhance your heart health. Pairing your vitamin C with your iron maximize the absorption. Your vitamin E and selenium, which is an essential mineral found in small amounts of the body, it works as an antioxidant and especially great when you combine these two together. And they do have the vitamin that says vitamin E and selenium. Your C and your B12, you C and your zinc, C and iron, calcium and D, D and K2, D and omega-3, and magnesium and your D3. So when to visit your healthcare provider. If you're taking any type of supplements or supplement combination and experience any negative effects, you want to stop using that supplement and you want to speak to your provider right away. Some of this effects you may have, some people have itchy skin, rash, hives, swelling of the throat, lips. Those are things: nausea, vomiting, diarrhea, difficulty urinating, decreased urination, dark urine, blood in your stool. Any one of these side effects that you're having while you're on a supplement, you might want to, you should stop it and notify your provider right away. Again, if you're feeling fatigue, yellowing of the skin and the eyes, severe joint and muscle pain, abdominal pain, please speak to your provider and be honest about what you're taking. You should also talk to your provider about any supplements you take if you recently had or will be having surgery. Because there's some supplements you need to stop a few days before, and you cannot take them a few days after. So please make sure that you are speaking to them. And just in case you don't know, just like we have home COVID tests, guess what? They also have home tests that you can detect whether or not your level of various vitamins is too low within an ideal range or too high. So you can check those out as well if that's something that you may be interested in. But the best checkup is going to be your doctors checking your levels. And it's important that you have your levels checked at least every 6 months. In summary, taking a supplement that claims to help with certain health conditions can be as easy as buying something from online or your local health and wellness store. However, if you take more than one or take supplement while on medication, there might be a risk for negative interactions. Symptoms of negative interactions can include fatigue, again, yellowing of the skin, severe muscle pain, just to name a few. Take water-soluble vitamins like your B vitamins and your vitamin C with a glass of water and a meal or snack. For some people, this might work best first thing in the morning while eating breakfast or at lunch. Keep in mind that some vitamin supplements and mineral supplements may interfere again with certain medications, including your antibiotics, blood thinners, and blood pressure medications. Finally, take your dietary supplements in the recommended daily dose and pay attention to what you eat. Taking an excessive amount of whether it's a supplement or anything can result in large doses of specific nutrient, which can be harmful to your health. So you do things in moderation. I want to give special acknowledgement to the National Institute of Health Office of Dietary Supplements, National Medicine Database, Medline Plus, and the U.S. Food and Drug Administration for the information that I provided you today. I hope this was helpful. I'm sure I'm going to have questions in the Zoom, so I'll be waiting for you. God bless. Enjoy the rest of the service.